Please allow me to introduce myself. I am Princess Atapang, student nurse from Southwestern University, FUNDA. Today I will be taking my patient's vital signs. So in initial steps, is to identify the patient, is to make sure that this is the right patient. So ma'am, can I ask for your name and birthday?
So my name is I will also ask her consent for if I can touch.
Okay, so the purpose of taking your vital signs is to assess your overall health and detect any potential issues may be present in your health. So can I get your consent during the entire procedure to touch you? Next is to prepare all the materials needed and make sure that this is the right condition. Then provide privacy and perform hand hygiene.
Good afternoon, Miss. I am Trisha Tanalio from DSN1 Equal.
First,
today I will be doing
take the body temperature of the patient by positioning the patient for comfort. We'll be taking the auxiliary temperature of the patient. I will also get the thermometer on its holder.
Sir, is it okay if I am going to proceed in examination?
Turn on the thermometer and place it in the
Okay,
armpit
so
of the
next we
patient.
have to prepare all the equipment that is needed, and it is already prepared. Make sure that it is in a good condition. And then after that is we have to provide privacy to our patient, making sure that all the curtains of
While
the room
waiting
is
for
closed
the
or
thermometer
doors are
to
closed.
beep,
Next is I am going to perform
we will
hand
check
hygiene to
the
avoid
pulse of
contamination.
the patient by positioning the patient's arms
Now we will begin
to
with
provide
assessing
for
the body
comfort,
temperature of my
and
patient.
the
So
patient will
first,
be relaxed and supported.
I will ask my patient to be
I'm
in
using
a
the
good
index
position
finger
where I
and
will
middle
measure
finger.
his auxiliary
I will
temperature,
put
and
it
I am
in
going
the
to remove
inner
the
wrist
temperature the
over the
thermometer
adjacent bone,
out of its holder, and
which is known
I
as
will
the
turn it on
radial
and place it
artery.
at the armpit of my patient. So sir, is it okay if I will be
And
the one
count
to
the
place it in your
patient's
armpit,
pulse in 1 full minute.
Again, we hold it. So while waiting for the beep of the thermometer, I am going to count for its pulse by placing my index and middle finger and looking for the radial artery of my patient. I will measure it in a 1 full minute using a watch.
36 degrees Celsius. And then his resting rate is 50. Respiratory rate is 50, and then the pulse is 67, sir, and blood pressure is 124.
So, as we can hear, the thermometer beeps. So the patient's temperature is 36.2, which indicates normal. And while before proceeding to the getting the respiration of the patient, we need to clean the thermometer using an alcohol swab to prevent contamination, and place it back to the holder.
Okay, so upon checking the pulse rate of my patient, it is 85, which is the normal average.
Checking the pulse of the patient, I also noted for her respiration, checking the rise and fall of her patient's chest, and the inspiration and expiration. So the pulse and the respiration of my patient is both normal
To disinfect it first.
without her awareness. So, in taking the blood pressure of the
I will place
patient,
it back to the holder.
position the patient
Now I am going to assess the
comfortably.
respiratory rate of my patient. By
Rearrange the clothes of the
patient
patient
is not aware that I am taking his
to expose the
respiratory rate
area
so
where
that
the cuff
he
will be
cannot
applied.
affect her breathing. So the same position as I did with measuring the pulse rate, I'm going to place my index finger and middle finger at the radial artery, and for a 1
Place the cuff above the inner aspect of the elbow.
Make sure that the cuff is not too tight and not too loose. then after that, place the manometer of the gauze at the eye level. After that, using the index finger and the middle finger, palpate for the brow-tine artery.
Weight the top. Palpate the brachial artery of the patient. Note for the sound wait for 15 seconds so the diastolic pressure of my patient is 75. So place the stethoscope earpiece properly. And also take the brachial
Now I am
artery
going to tighten the screw
without touching the cuff.
and then inflate the cuff.
Then tighten again the valve. Note for the systolic pressure. So my patient's systolic
the
pressure
pulse
is
disappears
115
when it
over
is in the
the
apex,
systolic pressure which is
diastolic
75, which indicates normal.
And now I
Then
am
remove
going
the
to
cuff.
use a stethoscope, placing the diaphragm of the stethoscope at the bronchial artery of my patient, and then I have to make sure we're in the sewer level of the couch where I can hear the sounds.
Then in taking the aftercare, we need to perform hand hygiene to avoid contamination. Note the patient's pulse, temperature, blood pressure, and respiration. And if any abnormalities upon checking, we will discuss it to the doctors. Thank you.